my name is Brianna Axon, and thank you for joining us for our presentation today. We are Liberty University Health Promotion students, and today we'll be discussing chronic diseases. We chose this topic because chronic diseases are a very prevalent issue in the United States. According to the CDC, chronic diseases account for 70% of all deaths in the United States. We will be covering various chronic diseases, and I will start the discussion with chronic kidney disease. First of all, chronic kidney disease is basically a condition that's characterized by a gradual loss of kidney functions. This disease has become a significant problem in the United States because of several reasons. The first is because there's just way too many premature deaths because of this. The second reason is because of high economic and medical costs in the private and public sector. Chronic kidney disease is often hard to recognize because the symptoms are very similar to that of diabetes and also high blood pressure. Oftentimes, people aren't diagnosed until it's too late. There are 5 stages of chronic kidney disease. The first stage through the 4 stages where people are often not diagnosed because the symptoms are very hard to recognize. But in the last stage, known as end-stage renal disease, at this stage the kidneys are no longer able to remove enough water or remove enough excess fluids from the body. Although chronic kidney disease can often result from primary diseases of the kidneys themselves, the major causes are diabetes and high blood pressure. So with that being said, you may ask, well, who is specifically affected? According to the Center for Disease Control and Prevention, there's 26 million Americans who are living with this chronic kidney disease currently, and there are millions of other individuals who are at risk. Specifically, those who are at risk are the elderly, those who have other kidney diseases, as well as those with diabetes, hypertension, and cardiovascular disease. Also those with a family history of chronic kidney disease. In the United States, between the years of 1988 and 1994, 10% of the population had chronic kidney disease. However, this percentage rose drastically during the years of 1999 through 2004 to 14%. Part of this reason is because the aging population is continuing to grow. Another reason is because there's more prevalence of diabetes and hypertension in the United States today, and there's no pinpointed reason why this is happening, but it's because of daily choices that Americans are making. So with all that being said, there's specific problems within the category of chronic kidney disease that need to be addressed. Healthy people had recognized them and set goals and objectives to deal with these issues. The first issue is the lack of recognition of the disease. Early diagnosis could permit early intervention as well as reduce cardiovascular disease events associated with chronic kidney disease. Healthy People 2020 set goals to address this specific issue by stating that to increase the proportion of people who have chronic kidney disease who know they have impaired renal function. With that being said, there's just too many people who have this disease who aren't even aware of what's happening to their bodies. So people just need more awareness with the disease. Along with that, Healthy People stated that they'd like to increase the proportion of those who have diabetes, type 1 and type 2, who are tested or will receive medical evaluation for chronic kidney disease. Because since those who have diabetes are the ones who are most at risk, it's important for them to be aware of these and have doctors test them for this specific disease. A second key problem with chronic kidney disease is the lack of transplants that are available for patients. In 1999, patients who received transplants within 3 years was 19%. However, in 2006, it's decreased to 17%. This downward trend is observable in all racial and ethnic groups as well as in men and women. This declining trend is not exactly understandable because we can't pinpoint the exact reason, but it's due because of the lack of available organs for transplants. Because the transplant list is so long, many patients with chronic kidney disease will die from kidney failure without receiving dialysis or a transplant. Healthy People has made it a goal to eliminate this issue. They'd like to do this by increasing the proportion of dialysis patients who are waitlisted and will receive a transplant within 1 year. They'd like to decrease this percentage by 10%. Healthy People would also like to reduce the number of deaths for individuals who are receiving a functioning kidney transplant. In 2006, 32.6 deaths per 1,000 transplants is what occurred. However, Healthy People would like to decrease that to 29 deaths per 1,000 people. Healthy People is continuing their goal to improve Americans' health by fighting chronic kidney disease. By meeting their goals and objectives, Healthy People will reduce kidney disease incidences, allow individuals to live longer lives and better quality of life who have chronic kidney disease, as well as eliminate the disparities among chronic kidney disease patients. Now I will pass the discussion to Candace, who will give us a further discussion of end-stage renal disease.
Hello, my name is Candace, and I'll be talking about end-stage renal disease. With time, chronic kidney disease, as she talked about, can develop into end-stage renal disease. According to the World Health Organization, a chronic disease is a disease that lasts for a long time or progresses slowly. End-stage renal disease is when kidneys stop working well enough to live without dialysis and a transplant. It is not reversible whatsoever. End-stage renal disease is currently a significant chronic disease in America that contributes to a vast amount of suffering to those who have the disease. End-stage renal disease is responsible for premature death and personal financial loss. End-stage renal disease is mostly determined by genetics, but can also develop as a result of environmental factors and individual behaviors and post-early stage kidney disease. It can also be caused by hypertension or high blood pressure. You are more prone to get end-stage renal disease if you, 1, already have chronic kidney disease or any stage of kidney disease. 2, if you have injury or trauma to your kidneys, and 3, if you have major blood loss relating to any type of activity or incident. Several studies that have been done over the past 10 years have shown that too much protein in the urine predicts faster progression of chronic kidney disease to end-stage renal disease. People who have diabetes are more prone to this. There are drugs like angiotensin converting enzyme and angiotensin receptor blockers that have been proven to slow the progression of kidney disease, therefore slowing the progression to end-stage renal. Hopefully, if you use those drugs and you're treated with those at the doctor, you may not get end-stage renal disease. However, the most common cause of kidney failure is diabetes. The initiatives, community programs, and guidelines of the National Institute of Diabetes and Digestive and Kidney Diseases to reduce diabetes are consistent with the chronic kidney disease and end-stage renal failure 2020 objectives. When talking economically, nearly 25% of the yearly Medicare budget is used to treat people with end-stage renal disease. Over time, the proportion of people with end-stage renal disease who receive a kidney transplant within 3 years of applying is decreasing. This declining trend is because of a lack of available organs for transplants. The shortage of transplant organs has initiated the U.S. Department of Health and Human Services to form an advisory group to address this issue. The shortage of donor kidneys and the over-reliance of dialysis has led some people to get an illegal transplant. Some experts have suggested that in order to increase the amount of donor organs, there should be a monetary reward. However, that is currently illegal in the U.S., and the World Health Organization and many other organizations oppose this idea. Some ethnic groups like African Americans, Hispanics, Native Americans are at increased risk for end-stage renal disease. There are 3 different medical tests that can detect end-stage renal disease. These are a blood pressure test and a urine albumin test, and also a serum creatinine test. However, the best way to measure your level of kidney function is by a glomerular filtration rate test. You can do this at your own risk at home. You can get the kit at I think you can get it at your doctor's office, and you can test your results and give your results to your doctor, and they can measure how your kidneys are working and whether or not you do have a kidney disease. Some symptoms of end-stage renal disease are constant tiredness, trouble concentrating, poor appetite, trouble sleeping, muscle cramps, swollen feet, ankles, and dry skin. Some practical ways to prevent end-stage renal disease is to maintain a healthy diet, get an adequate amount of sleep, an adequate amount of exercise, and avoid using alcohol and drugs. And most importantly, to get the treatment needed for the kidney disease that is already present. Healthy People 2020's goal is to reduce the new cases of end-stage renal disease along with its complications, disabilities, deaths, and cost. Now my colleague Janessa will speak about diabetes and amputations.
Hello, my name is Janessa Sabanos, and I'm going to talk to you a little bit today about diabetes mellitus and lower limb amputations associated with this particular disease. Now, diabetes is basically a lack of insulin or lack of glucose uptake by the body's cells. And just a few weeks ago, on November 15, 2012, the International Diabetes Federation announced the number of people living with diabetes is now at 371 million, which is up from 366 million announced a year ago. The International Diabetes Federation expects the number to reach 552 million by 2030. In the U.S. alone, there are 24.1 million people with diagnosed diabetes, and that is according to the International Diabetes Federation. Even though the rate of diabetes mellitus appears to be rising, there are many organizations worldwide which are doing a really great job at combating diabetes. Some of these include the American Diabetes Association, the International Diabetes Federation, and Healthy People 2020. Healthy People 2020 has set a goal to reduce diabetes mellitus and improve the quality of life for all persons who have diabetes or are at risk for developing diabetes mellitus. There are a lot of complications associated with diabetes, but one in particular which doesn't receive a lot of attention is lower limb amputations due to diabetes. This occurs primarily for three reasons. When a person has diabetes, they have a lack of blood flow, they have nerve damage, and there's an excessive amount of glucose in the blood, and someone can develop something as small as a blister or a cut, which can become infected, and they won't feel that infection because of the nerve damage in their feet. And bacteria loves to feed on sugar, so the glucose in the blood basically feeds and festers that infection. And also lack of blood flow means lack of white blood cells to that area. So literally someone with diabetes could lose a limb because of a small blister or paper cut. The American Diabetes Association reports that diabetes is the most frequent cause of non-traumatic lower limb amputations, with more than 60% of non-traumatic lower limb amputations occurring in people with diabetes. According to the American Diabetes Association, in 2006 alone, about 65,700 non-traumatic lower limb amputations were performed in people with diabetes. As a person ages, they become more susceptible to the development of diabetes mellitus, and statistics on healthindicator.gov show the individuals age 65 and older are the ones most vulnerable to amputations due to diabetes. So it's important that we recognize that age span of 65 and older, because a lot of times they might not have health insurance, they might not have caregivers, and they're going to be less mobile. So if they were to develop a blister or a sore, they might not have anyone there to treat it, look over it for them. They also might not have the insurance to go to the doctor and get it treated, and they also may not be they won't be able to feel it because of the nerve damage, but they won't be able to look at it as easily because they're not going to be as mobile to, you know, look at their body and to bend over, and they won't have that agility. So it's really important to understand that that age group needs a lot of attention. They need people to help them, and they also need to be educated on the risks that come along with diabetes. And between 2007 and 2010, there has been a decrease in lower extremity amputations among patients age 65 and older, but the amputations went down from 47.35 to 39.33 per 100,000. So even though diabetes, the rate is increasing, the amputations associated with diabetes, those are decreasing. So that is a positive sign. 9 out of 10 non-traumatic lower extremity amputations are instigated by an infection. And according to NYU Langone Medical Center, infection, gangrene, and amputations are often preventable if patients are educated to carefully monitor their feet for problems. and also if they seek timely medical interventions when a problem develops. Early treatment is the best way to avoid amputation, and as health educators, we play a crucial role in education and prevention. So it's important for us to recognize that if we can teach the patient early on, not just prevention of diabetes, but if an individual has diabetes, this is what you need to be aware of. You need to understand that you may have a sore on your foot and you may not feel it. You need to have someone check it for you, or you need to check it daily. And so it's important to teach them to look for those cuts and blisters, to care for the cuts and blisters or abrasions immediately instead of letting it go. They need to seek professional help at the first sign of a foot problem. They must eat healthy. They need to have a balanced diet. They need to consider a multivitamin so that they have adequate vitamins and minerals and nutrient intake. And they need to exercise regularly to increase that blood flow and insulin sensitivity and maintain a healthy body weight. And also smoking is another factor that they should reduce if they want to improve their diabetes. So now I'm going to hand it over to Casey, and she's going to be talking about coronary heart.
Heart disease is the first leading cause of death in the United States, according to Healthy People 2020. More than 1 in 3 adults live with one or more types of cardiovascular disease. According to the National Library of Medicine, in the United States, the most common type of heart disease is coronary artery disease, which can lead to heart attack. Heart disease is disproportionately distributed across the population due to certain disparities based on gender, age, race and ethnicity, geographic area, and socioeconomic status. Some of these disparities are prevalence of risk factors, access to treatment, appropriate and timely treatment, treatment outcomes, and mortality. Cardiovascular health is significantly influenced by the physical, social, and political environment. Maternal and child health is one of those factors, along with access to educational opportunities, availability of healthy foods, physical education, extracurricular activities in schools, opportunities for physical activity, and walkable communities are also incredibly important. One of the emerging issues with cardiovascular health is that there isn't a system currently for our nation that can track how many cardiovascular events occur, how many reoccur, and how many deaths result because of them. So as health educators, we need to be developing a program that will help to track those cardiovascular events. According to PubMed, some of the symptoms include chest pain or discomfort. That is actually the most common and what people think of as the typical cardiovascular disease symptom. People may also experience a heavy chest or feel like their heart is being squeezed. Some of the other symptoms include pain in the breastbone, as well as the neck, arms, stomach, and upper back. Pain may also occur with activity or emotion, but this can be relieved with rest or nitroglycerin, and people may also experience fatigue while with activity or shortness of breath due to activity. As health educators, we also need to be educating women, elderly, and diabetics that they might have different symptoms. Their symptoms may include fatigue, shortness of breath, and general weakness. By helping them understand what these symptoms are, we can help them to understand their problems so that they may make it to a doctor in a timely fashion. According to Healthy People 2020, contributing factors to coronary artery disease are high blood pressure, high cholesterol, cigarette smoking, diabetes, poor diet and physical inactivity, as well as overweight and obesity. And these risk factors can actually lead to heart disease, heart attacks, heart failure, as well as strokes. And it is important that we address these issues early on in life. One of the main contributing factors, high blood pressure, is actually seen and 1 in 3 adults in the United States, according to Healthy People 2020. And more than half of those with high blood pressure do not have their blood pressure under control. One of the main ways we can promote the decrease in high blood pressure would be to decrease the high sodium intake that our nation is experiencing, which is 90% of Americans exceeding their recommendation for sodium intake. So we should be encouraging people to lower their sodium intake. To help prevent cardiovascular problems, we should be helping people to understand how to improve their diet, exercise, control of high blood pressure and cholesterol, smoking cessation, and appropriate aspirin use. According to the U.S. Preventative Services Task Force, they recommend the use of aspirin for men ages 45 to 79 years, when the potential benefit due to a reduction in myocardial infarctions outweighs the potential harm due to an increase in gastrointestinal hemorrhage. The U.S. Preventative Services Task Force also recommends that women age 55 to 79 years, when the potential benefit of a reduction in ischemic strokes outweighs the potential harm of an increase in gastrointestinal hemorrhage, they should then be using aspirin as well. We also need to be encouraging primary care physicians to help people with behavioral counseling with life issues such as diet. One of the best ways is to either have the physician speak to them about their diet or to recommend that they see a nutritionist or a dietitian. We also should be screening for high blood pressure in adults depending on their age and their gender, as well as if they are at risk. Some of the tests for heart disease include coronary angiography, echocardiogram, electrocardiogram, exercise stress test, heart CT scan, and nuclear stress test. According to the article, stress testing and non-invasive coronary angiography in patients with suspected coronary artery disease, time for a new paradigm, we should be expecting to see in the next few years that stress testing will be evolving into a secondary role for the assessment of patients with suspected CAD, and this will provide information on hemodynamic significance and ischemic burdens in patients with CAD in a moderate to severe range. Doctors should be talking to their patients about certain treatments and lifestyle changes. If the patient needs medicines, then they can receive medicines for risk factors such as high cholesterol, high blood pressure, irregular heartbeat, and blood flow. And some of the goals for treatment are to lower blood pressure levels so that they are less than or equal to 140/90, and even lower for patients that are either diabetic, they have kidney disease, or if they have had heart failure. HbA1c levels, if diabetic, should be at a level recommended by their doctor. And for LDL and cholesterol levels, we would like to have them either at or below 100 milligrams per deciliter, and even lower for some patients. The Healthy People 2020 goal is to improve cardiovascular health and quality of life through prevention, detection, and treatment of risk factors for heart attack and stroke. Early identification and treatment are key for heart attack and strokes and prevention of repeat cardiovascular events. I'm now going to pass it on to my colleague Marina, who will be speaking on COPD.
Hi, I'm Marina, and I'm going to talk on the topic of chronic obstructive pulmonary disease, which is also known as COPD in the U.S. COPD is the fourth leading cause of death in the U.S. This chronic disease poses a heavy burden on public health, but with specific methods of detection, intervention, and treatment, COPD's burden can be reduced. COPD is a preventable but not a curable disease. It is the occurrence of chronic bronchitis and emphysema. COPD is characterized by airflow limitations in the lungs. With a person with COPD, can inhale air into the lungs, but the alveoli in the lungs would not allow the lungs to recoil, letting the air back out. COPD is often called often known as air trap lungs. The airflow limitations are usually progressive and associated with the abnormal inflammatory response of the lungs due to long exposure of noxious gas or particles such as cigarette smoke. The three main causes and risk factors of COPD includes cigarette smoking, inhaling toxins, and family history. A person with long-term COPD often exhibits symptoms such as coughing with or without mucus, wheezing, and shortness of breath. According to the article of Issues Concerning Health-Related Quality of Life in COPD written by Dr. Jones, COPD is a silent disease because in its early stage, a patient may not exhibit any symptoms. This is why many people may have COPDs, but they do not know it because they do not exhibit any symptoms. And when they start to present with those symptoms, they already catch it in a later stage. In 2006, approximately 120,000 individuals died from COPD because they detect the disease too late. And nearly 8 out of 10 COPD cases is caused by exposure to cigarette smoke. This is why many governmental agencies work together in trying to eliminate this issue. One of Healthy People 2020's objectives in solving COPD problem is to reduce deaths from COPD among adults who are 45 years old or older. This is one of Healthy People 2020's objective is because approximately 112 out of 100,000 adults died from COPD in 2007. There is no cure for COPD. However, there are many management strategies to help relieve symptoms and keep the disease from getting worse. These management strategies include smoking cessation, avoid smoke or dust, get vaccinations for flu and pneumonia, rehabilitation, drug therapy such as inhalers, nutrition, and lung surgery transplant. A person with COPD must stop smoking because this is the best way to slow down the lung damage. However, this is easier said than done because most COPD individuals who smoke have already developed an addiction to nicotine. This is why organizations such as CDC, COPD Foundation, World Health Organization, and Healthy People 2020 join in to help make smoking cessation easier, which in turn will help reduce deaths from COPD among adults. These organizations joined together and set up many tobacco control programs, smoking bans restrictions, mass media campaigns against smoking, and getting the government involved in making laws and regulations to increase tobacco products prices. All of these strategies are very effective in reducing COPD deaths among adults. However, in my opinion, the most effective in reducing COPD is the tobacco cessation programs with education that is targeting high school students and young adults. If both high school students and young adults are being informed earlier in their years before they developed their smoking habits, they will be more likely to quit and it'll be easier for them to quit as well. According to the Guide to Community Preventive Services, effective tobacco use cessation programs should include provider reminder system and provider education, which are multi-component strategies to increase tobacco use cessation. These strategies provide education as well as intervention methods in helping individuals to quit smoking. This type of program has been proven to be very effective in increasing smoking cessation. Once high school students and young adults are being educated about the risks of tobacco use, their attitude will start to change towards smoking, which in the long run will reduce the number of COPD deaths among adults who are 45 years old or older. Thank you for listening to us, and we will now be taking questions.